When we're looking at the knee, one of the things that we need to make sure is the structure of the knee is doing all right. So we're going to run a couple easy orthopedic tests to test the ACL and PCL, which are very important ligaments in the knee. And then we're going to test the collateral ligaments, which those ligaments hold the knee nice and tight together. And a lot of times if we have some sort of trauma, that can injure those areas. The next thing that we're going to look at is two pads of cartilage in the knee called the meniscus, and those can be injured due to trauma, or it can be injured due to degeneration over time. So a lot of times we see that those kind of components of the knee are doing okay, so we're going to look at the broad aspect of it, and it leaves us with a lot of soft tissues. So we have a muscle, kind of a tendon on the outside of the knee called the TFL, or that IT band, that can get strained. We can also see where a group of muscles called the pes anserine comes together in the knee. And then if that's the issue, what we're going to do is we're going to use a soft tissue therapy. So we have some special tools in the clinic, and we're going to go in there and we're going to start working on that area. And these tissues should be able to have a nice, good glide when we're walking, when we're running, when we're moving. But a lot of times that tissue starts to get restricted after it's been injured. So as we work on it, we're going to start freeing that tissue up, allowing that fascia to glide and to move. The other thing with the knee we really want to look at is a lot of patients come in and they're having issues kind of with their patella or these tendons, and here the patella tendon and that quadricep tendon. So we need to make sure that there's nice, good stability in there. And there's some exercises that patients can work on to really strengthen that area and get that back on track. So a decent amount of things going on with the knee right in that area, but the majority of them can be worked on and we can get some really good improvement in there. And we're also going to look globally, and we want to look into some of the muscles into the hip that stabilize that knee, create strength, and we're going to make sure that the feet in that area from the ground up is creating some good support. So a couple things in there that we really need to look at for the knee, but if we look at it, treat the right things, we get a really good response, just like this case that you've seen here.